Doctors are the backbone of the country's healthcare system. They play a pivotal role as guardians of our well-being. And to celebrate and recognize the frontline health warriors, the 7th edition of Mankind Presents Times Now Doctors' Day Conclave, powered by Lupin, concluded recently in the national capital. The conclave witnessed more than 500 delegates and doctors from across the country attending a day of thoughtful conversations, keynote addresses, and felicitation of doctors from across specialties for their accomplishments. Doctors' Day Conclave has been at the forefront of celebrating and recognizing frontline warriors since 2018. In his address, Dr. Jitendra Singh emphasized on strengthening national public health policies and India's leap towards Viksit Bharat.
One of the distinct features of this award ceremony is that you have specialists from virtually every stream. You have endocrinologists, you have diabetologists, you have gastroenterologists, you have oncologists, you have some of the pioneers in AIDS. And I think next time they would also have a more integrated gathering of the medical professionals, because the gaps that existed between different streams are also giving way to a more holistic approach. And I would recall, though I myself possibly been one of those, that in allopathy we never thought very seriously about the other streams or the oriental streams. But during the pandemic, I would receive phone calls from some of the medical colleagues who had settled in US for decades together, making frantic calls to find out if there was anything in Ayurvedic which could be an immunity booster. So when you are faced with the threat of life, you know how to unite. So I'm sure this is a good beginning made by Times Now. This is a group which has been pioneer in more ways than one, and I'm sure the tradition will carry on and we'll have the opportunity coming together under the same roof again and again and yet again. Thank you very much.
Lieutenant General Arindam Chatterjee, Director General Medical Services of the Indian Army, delivered a special address on military medicine, bridging the gap between battlefield and home front.
This military medicine that we practice gives us a very wide understanding of human health and human behavior. So when you say bridging the gap from the battlefront to the home, it's not an easy journey. It requires that the soldier and those of us who support them need to understand what the battle milieu is, what happens to an individual when he's going into battle, what physiological changes are taking place, and the mental makeup that is required. It's an amazing journey. I've put in 40 years in the service. It's an amazing journey to serve with these soldiers when they're going into battle or they're under fire.
Atish Majumdar, Senior President, Mankind Pharma, delivered an insightful address on the evolving strategies for managing non-communicable diseases and the innovative approaches needed to tackle these health challenges effectively beyond 2024.
We celebrate the birthday of one of the greatest doctors ever born in India, Dr. B.C. Roy. And through his birthday, we celebrate the achievements, the contributions, the sacrifices, and the way doctors touches our lives every single day. Over a period of 25 years, I have traveled the country and met doctors in Kanyakumari, Imphal, Srinagar, Bombay, you name a place, I have been around. And over these 25 years, I have seen our doctors do their practice, treat patients, touch the lives of people every single day, never ever remembering the constraints they have. You know, when a patient comes to our doctors, they kind of walk into a God's chamber. That's the belief with which they walk in. And if one were to look at the challenges of space, infrastructure, the pricing of the solutions, the medicines, everything put together. And when you see this whole spectrum, you realize today is only Doctor's Day, but for us, people who have seen this every day, my brothers in the pharma industry, for us every day is a Doctor Day. My salutations to all of you, for all the things that you do every day, the way you touch and the lives of all patients and make a better India.
In an interesting panel discussion, distinguished panelists address the critical need for a new and comprehensive approach to combating addiction-led non-communicable diseases.
Today's topic is the addiction-led NCDs, and that's what makes today's discussion a little more focused.
The first concept is change your lifestyle. And I think NCD, addiction-related NCD, falls under that ambit. Now, one of the most important reasons and things to understand is that there is a distinction between nicotine and tobacco. Nicotine by itself is a chemical substance. It is naturally occurring. It is just like caffeine available in coffee. But the delivery system of nicotine is where the main problem lies. You have cigarettes, you have oral tobacco, you have snuff, you have different kinds of products. It is the delivery system which actually causes the main problem with when you look at the NCDs.
Addiction-led NCDs, while typically we look at heart disease, cancer a lot, we have probably underestimated the importance of lung diseases that it can cause. We now know that if ischemic heart disease is the number one cause of death, does anyone remember the second commonest cause of death in India after ischemic heart disease? It's actually chronic obstructive pulmonary disease. It's the third largest worldwide, but the second largest in India. And essentially, one of the factors is, of course, addiction-led NCDs. There are other factors as well.
This is the right time we should wake up. Just now you heard about nicotine, hypertension, and related subject, but I concentrate for younger generation only two things if this house takes away this message. One is our diet, and second is smoking.
If you looked at Finland in 1970s, it was the place which has the maximum cardiovascular issues. But the Finland-Carolina study done over a period of a project done over a period of 25 years reduced cardiovascular outcomes by 80%. So the big learning that comes from there is that if you make people aware, you can get the desired behavior.
We have something called COPTA that regulates, controls tobacco usage in this country. In 2019, they brought out a law which actually talks about banning e-cigarettes. And while by the very essence of that policy is that they considered e-cigarettes and like similar products like a tobacco cigarette product, and they completely banned it. So what we are trying to do, working with the ministry, is to help them to understand that banning is not the solution. Let's find a middle path.
The event continued with the coffee table book unveiling. The Conclave, keeping to its spirit of recognizing and honoring the frontline healthcare professionals, felicitated doctors in the category Legends of Medicine. The honorees were Dr. Indraneel Haldar, Dr. Suhas Bardapurkar, Dr. Raghupati Narasimhan, Dr. Nadeem Arshad, Dr. Muhammad Ismail. Hirak Bose, Senior Vice President of Sales and Marketing at Lupin, delivered an engaging presentation on patient-centric initiatives. He outlined how Lupin is prioritizing patient needs through innovative strategies including enhanced healthcare solutions and personalized care models.
Since time immemorial, doctor fraternity has always been supporting as well as helping the human peoples for their well-being. That's a wonderful thing. And we at Lupin really deeply admire each and every efforts of the doctors, their dedication, their selflessness, which has really taken this profession to the next level. Today I am really happy to stand in front of you and talk about a subject which is very, very close to me, that is patient centricity. I would just like to share my thoughts, my perspective on the flow of Indian healthcare, access to quality healthcare followed by need for patient centricity initiatives, patient centricity, a big win for patients and HCPs, implementing patient-centric strategies, collaboration of our healthcare ecosystem, and leveraging technology.
India's development in the last 10 years has been notably impressive. Over the last 10 years, India's healthcare system has also undergone significant transformation marked by enhanced medical accessibility, elevated service standards, informed patient engagement, and improved adherence to treatment protocols. Despite these advancements, out of 191 countries in performance, with only 3.6% of GDP allocated to healthcare, we must address this issue with a focus on pioneering therapeutic solutions, scaling up production capabilities, and embracing digital innovation and adoption. The vision of Viksit Bharat, a strategic initiative driven by the government and Niti Aayog, aims to make India an economic powerhouse by 2047. At Lupin, we have implemented several exemplary patient support programs catering to varied condition and therapy areas. We follow an integrated healthcare approach to raise awareness, offer counseling, enabling medication adherence, encouraging healthy lifestyle habits, and ensuring condition and disease monitoring. Our first patient support program is Hamrahi, which is our diabetes management program, which raises awareness, offers complementary medicines, provides counseling to more than 30,000 patients. Jai, another PSP, Joint Airway Initiative, which is India's first digital asthma educator platform, provides correct inhalation techniques for effective asthma symptom management. It is a flagship program for our respiratory therapy area, where more than 20,000 patients have been enrolled. Jeet is a unique reward-based program which is in cardiovascular therapy area focused on the cardiovascular disease management. It promotes heart health by rewarding positive patient behaviors, and we have almost 15,000 patients as far as Jeet is concerned. Then we have a Nova Shakti program, which is a program pioneering women's heart health initiatives. Nova Shakti is a powerful platform that empowers women in their battle against heart diseases and fosters the crucial physician-patient journey. So if we have to summarize, then India's healthcare system stands at a critical juncture, poised for transformative change. By acknowledging the challenges, prioritizing strategic investments, and embracing collaborative solutions, we can pave the way for a future where quality healthcare is accessible, affordable, and equitable for all Indians. Together, we can build a healthcare system that not only addresses the needs of today, but also shapes a healthier tomorrow for generations to come.
The event continued with the coffee table book unveiling. The felicitation continued with doctors being honored in the chest specialists category. Dr. Animesh Arya, Dr. Ashok Pandurangji Arbat, Dr. Deependra Kumar Rai, Dr. Gajendra Vikram Singh, and Dr. K. Venugopal. The next doctors to be felicitated were in the respiratory category. Dr. Abhilash Kottayal, Dr. Brijesh Prajapati, Dr. Debraj Chash, Dr. Giriraj Bammai, and Dr. Himmat Singh Rathore. In the next category of orthopedics, the doctors felicitated were Dr. Abhishek Bhalotia, Dr. Ajit Nalavade, Dr. Ashok Kumar, Dr. Ashwin Kasturi, Dr. Gurinder Bedi. In the cardiometabolic specialty, the doctors felicitated were Dr. Anurag Singhal, Dr. Balram Sharma, Dr. Basavaraju Basavalingappa Raju, Dr. Gajendra Vinod Agrawal, in the category Oncology, the doctors felicitated were Dr. Anita Ramesh, Dr. Arun Seshachalam, Dr. Dinesh Pendharkar, Dr. Dipsha Kriplani, in the category Gastroenterology, the doctors felicitated were Dr. Abhay Kumar, Dr. Bhaba Dev Goswami, Dr. Bharat Bhushan Gupta, Dr. Bilal Ahmad Khan, Dr. Bimal Kumar. In the category Intensivist Orthopedics, the doctors felicitated were Dr. Abdul S. Ansari, Dr. Ajoy K. Sarkar, Dr. Anand R. Sutar, Dr. Atul V. Ingale, Dr. Chirag N. Chatwani.
We at TattvaCare intend to create a digitally integrated healthcare ecosystem which not only enables connecting the entire patient care continuum but also fosters avenues for better healthcare outcomes for the patients. We believe health tech is poised for a breakthrough similar to what fintech experienced with UPI, especially after spurt in digital adoption in healthcare post-COVID. This is significantly aided by government's ABDM initiative, which intends to create a robust digital health infrastructure in the country. With advancements in various aspects of digital healthcare, we are excited to be at the forefront of delivering accessible, affordable, and equitable care to the citizens of the country.
The Conclave also hosted the Leaders' Dialogue on the Big Healthcare Reset, India's global healing touch ensuring leadership in international health diplomacy.
The question here is quite important. Cardiovascular disease burden globally is immense. Can you believe it? That over the last 10 years, deaths from cardiovascular disease have grown from 120 crores across the world to 200 crores in 2022, in exactly 15 to 20 years. And what's even more important, that cardiovascular disease, 600 crore people are affected by cardiovascular disease. The impact of deaths, as we're talking about, means 56,000 people die of cardiovascular disease every day. It accounts for 1/3 of the deaths, all deaths across the world.
Today, we are very proud to say that as an industry, as an Indian pharma industry, we are third largest in the world when it comes to volume. We are 14th largest when it comes to value. That's a huge achievement. Coming from a time when majority of the drugs would be imported in the country, we create a surplus which is as big as our domestic consumption, and we are able to give it to the world.
So if we look at India's experience and expertise, if any procedure is done anywhere in the world, it's done with outcomes comparable to the best centers in the world in India today. We do more than 300,000 open heart surgeries every year, more than 250,000 joint replacements, about 35,000 robotic surgeries, about 25,000 organ transplants a year. And we do all of this at a cost which is 1/5 to 1/10, because we understand frugal innovation.
Now, for drugs, and the next frontier is new drug discovery, which has been alluded to by one of the speakers, and I think that will require investment in time and money, but new drug discovery is the next frontier. Medical devices and diagnostics, point of care, India is taking off, and I think that needs to be consolidated more.
Post-independence in this country, one of the most important establishment in medical field is All India Institute of Medical Sciences, AIIMS, which has lived up to its reputation. And it has given the pathways, vision for our everybody in this society, right from the lowermost society to the topmost people of this country. We lived up to that. And if you look into today's time, I feel proud that I am one of the AIIMS faculty, like Dr. Balram here.
The conclave also witnessed an invigorating discussion by experts on the collaborative initiatives and policy ambitions to revamp India's health sector.
There's a paradigm shift in the challenges that we're facing as far as the health sector is concerned. Both the burden of disease has shifted from infectious diseases to non-communicable diseases, and therefore the challenges are different. Infectious diseases, you treat a patient with malaria, dengue, and that's it. But non-communicable diseases is a treatment for lifelong.
Many times there is a criticism that we have too many PG doctors, why we need to improve on this ratio, which is not true. Because every UG students must have opportunity to do the postgraduate education. And once we will reach there, we will certainly able to address the quality issue in more effective manner.
Most of the MBBS doctors are either going for post-graduation and super specialty, or they are going for abroad. So hardly MBBS doctors is practicing nowadays as a family physician.
You don't require degree or so. This degree came only because people were going for post-graduation. Otherwise, at that time system was that people will do MBBS, they will go to rural center, or they will be posted at district hospital. Within 7 or 8 years, people with MBBS degree or even GMS, they used to be fantastic surgeon. They were doing all sort of jobs,
You know, the government had proposed a common exit exam for MBBS students, which would be done after the final year. When we passed out, we had internship where we actually went through we were made to do surgeries, we treated heart attacks and all that. 12 months, we went through every department. Now actually these students are just mugging up during that time. They want to crack the exam.
Dr. Vandana Bagga, Director, Directorate of Family Welfare, Government of NCT of Delhi, Ministry of Health and Family Welfare, delivered a special address on Health for All and India's urban-rural healthcare divide.
The National Rural Health Mission was launched in 2005. And the aim or the target of National Rural Health Mission or NRHM was to ensure the accessible, affordable as well as quality health care among the rural population, with special importance given to the vulnerable group of the community. And then later on it became a part or a sub-mission of National Health Mission, that is NHM.
Mankind presents Times Now Doctors' Day Conclave 2024, 7th edition, powered by Lupin, celebrated the unwavering dedication and innovation of our healthcare professionals. Their relentless commitment to advancing medical care and improving patient outcomes continues to inspire and drive progress in India's healthcare landscape. Until next time, let's keep championing the heroes of our health.